gave of what he did, what the video itself says and shows to lay people and to experts. And now we have, finally today, the full autopsy report. The question is, how do they square with one another, and where do they all leave us on the ultimate questions about what happened to Eric Garner? Today, as I said, we obtained a copy of the autopsy report. A short time ago, I walked through it and some of the video with forensic scientist Eric Garner of the John Jay College of Criminal Justice and emergency medicine physician, Dr. Sampson Davis. So, Dr. Kobylinski, you've looked at the autopsy report. I want to talk about the chokehold, because in the autopsy report it said compression of the neck as well as compression on the back led to the cause of death. Let's look at this part of the video where the chokehold is used.
Right. You see that?
You see starting there, but
left arm went around his right arm. If you look closely, went underneath Garner's right arm.
Let's pause it there.
And up. Right.
And so when he's down on the ground, it's still in a chokehold.
It's a chokehold, but the autopsy report shows this was a compression of the blood vessels.
Not of the windpipe.
Not of the windpipe, that's right. The blood vessel, the jugular vein was completely closed down, whereas the carotid arteries were still flowing. That's how you get the petechia throughout the membrane.
So wait, the carotid arteries, so blood was still flowing to the brain?
Blood was flowing to the brain,
So
yes.
what is closing down?
Well, in other words, you're compressing the jugular, so now blood is able to go to the brain, but not leave it.
And that's what the hemorrhages are
and
for.
that causes the petechia.
Okay.
Right.
And then, Dr. Davis, there's something called the hyoid bone, and I want to show a picture of it. This, again, is from the autopsy. There's a gap here.
Right.
Can you explain what that is and why this is significant?
So the hyoid bone is right above your cartilage here, your thyroid cartilage, and it attaches to the base of the tongue. And so as we get older, you see there's a gap here. As we get older, this bone fuses. It becomes one. Just like its hair is smooth and complete, it becomes smooth and complete.
So this is a natural gap. This is not some sort of a fracture.
Gap. Exactly. So as we age, especially in men, between 38 and 53, this will fuse. So we usually use this to identify how old a person is, identifiers during autopsy. But with Mr. Garner here, he was still 43, wasn't fused. But this makes this less likely to break, because you can imagine any outward pressure on this bone is going to give because of this gap right here. If this was fused, it would have most likely fractured or would have been broken during the choking.
Okay. And now there's the moment where he's actually on the ground. I want to show that video because, Dr. Kobylinski, you're saying that as important as the compression, let's pause it there, as important as the compression on the neck was, equally dangerous is what's happening here, which is somebody putting his knee and full weight, not only on the head, but on the upper back.
It wasn't only Pantaleo that should have been indicted. Well, I mean, there were others involved with this killing, because everybody who piled on, compressing the chest, could be implicated in this killing.
Right. So is somebody who isn't the size of Mr. Garner? Mr. Garner's BMI, his body mass index, I think is twice the average person.
Twice the high level of normal.
Of somebody of an average weight, though, would this maneuver of people piling on the back with the hip face pressed down still be dangerous?
Normally, a normal person that was not obese, Burking can kill a person without the chokehold considered at all.
Burking, what is Burking?
That's what Burking is, compressing the chest so that you can't expand, you can't breathe.
Right. I think there's three areas: the chest, the throat, and the fact that his head is turned also causes compression. And then, his comorbid issues, asthma, high blood pressure, it increases the likelihood of death with this position.
And Dr. Davis, in the report, there were several injuries that were listed as plethoric.
Right.
What does that mean?
So plethoric is like a rosy complexion or a collection of blood underneath the skin. So with the pressure around the neck in his facial area, you can see where the blood expanded in his facial area. So it gave it a rosy hue or a rose-like color to it. But it's just an increased blood flow secondary to distal pressure. And in this case, it was the pressure around his neck that causes a plethora of blood around his facial area.
Arteries are still open. Jugulars are closed. So pressure builds up.
Right. If the blood can't flow down, then it collects in the facial area.
Dr. Davis, Dr. Kobylinski, thanks very much.
Pleasure.
Thank you.
Well, up next, the latest on the protests still going on in New York, Chicago.